Hello and welcome to our channel. If you're a farmer, rancher, or simply someone who cares about the well-being of farm animals, you found the right place. Effective livestock disease management is the foundation of maintaining healthy, thriving herds and flocks. Diseases in livestock can lead to serious financial losses, reduced productivity, and sometimes even the loss of entire herds if not managed properly. In today's video, we'll be discussing the top strategies for effective livestock disease management. Whether you have cattle, sheep, poultry, or other farm animals, these strategies can be tailored to suit your needs, ensuring that your farm remains healthy and productive. From biosecurity measures to vaccination protocols and advanced disease surveillance systems, we'll cover everything you need to know to prevent and manage diseases on your farm. By the end of this guide, you will have a deeper understanding of how to keep your animals safe and how to approach disease management with confidence. Let's dive right in. Understanding the importance of livestock disease management. Effective disease management is crucial for any livestock operation. The health of your animals directly impacts your productivity, profitability, and reputation as a producer. Diseases can spread quickly in dense populations, causing significant losses if not addressed promptly. While some diseases are easily prevented, others may require more complex interventions. The first step in effective disease management is understanding the different types of diseases that can affect livestock. Infectious diseases, caused by pathogens such as bacteria, viruses, and fungi. These diseases can spread rapidly and may require aggressive management strategies, including quarantine, vaccination, and treatment. Non-infectious diseases. These are diseases that result from nutritional deficiencies, environmental stressors, or genetic factors. Examples include metabolic disorders, heat stress, and injuries. Parasitic diseases. Internal and external parasites are a significant concern for livestock health. Worms, lice, ticks, and other parasites can compromise animal health, reduce productivity, and lead to secondary infections. To manage livestock diseases effectively, it's essential to identify the type of disease and understand how it spreads, how to prevent it, and the best treatment options available. Biosecurity measures, preventing the introduction and spread of diseases. One of the most important strategies for effective disease management is biosecurity. Biosecurity refers to the set of measures implemented to prevent the introduction and spread of pathogens onto your farm. By practicing strict biosecurity, you reduce the risk of diseases entering your operation and spreading among your animals. Key biosecurity practices include controlling animal movement. Monitor the movement of animals on and off your farm. Implement quarantine protocols for new animals before they are introduced to the herd or flock. This helps prevent diseases from entering your farm, especially if the animals are coming from other farms with unknown disease risks. Sanitation and disinfection. Clean and disinfect all equipment, vehicles, and facilities that come in contact with livestock. Regularly wash and disinfect the clothing, footwear, and tools used on the farm. This prevents the accidental introduction of pathogens into your farm environment. Restricting access to farm premises. Limit the number of people who visit your farm and ensure that anyone who does enter follows proper biosecurity procedures. For example, farm workers and visitors should wear protective clothing and disinfect their footwear and hands before interacting with animals. Waste management. Proper disposal of manure and waste is crucial to minimize the spread of disease. Manure should be regularly removed and stored in designated areas away from water sources. Composting manure can help kill harmful pathogens and turn waste into useful resources for your farm. By implementing strict biosecurity measures, you create a protective barrier around your animals, reducing the risk of disease outbreaks and ensuring that your farm stays healthy. Vaccination, the first line of defense. Vaccination is one of the most powerful tools available for preventing infectious diseases in livestock. By vaccinating animals against specific pathogens, you help build immunity in your herd or flock, making it more resistant to disease. Vaccination can save your farm from costly disease outbreaks that could otherwise wipe out large portions of your livestock. Here's a closer look at how to use vaccines effectively. Understanding vaccine types. There are two main types of vaccines: killed vaccines, inactivated viruses or bacteria, and live vaccines, which contain weakened forms of the pathogen. Both types have their uses, and a veterinarian can help you determine which vaccines are best suited for your animals. Creating a vaccination schedule. Work with a veterinarian to develop a vaccination schedule tailored to your farm's needs. Some vaccines may be given annually, while others might require boosters. For example, cattle are often vaccinated for diseases like bovine respiratory disease, BRD, and leptospirosis, while poultry may require vaccines for Newcastle disease and Marek's disease. Ensuring timely vaccination. One of the most important factors in the success of a vaccination program is timeliness. Administer vaccines at the right time in an animal's life to ensure maximum effectiveness. Vaccinating too early or too late can reduce the efficacy of the vaccine. Monitoring vaccine efficacy. After vaccination, monitor your animals for any adverse reactions and keep an eye on their health. Also, track the effectiveness of the vaccine over time by conducting health checks and tests to ensure immunity is present. Vaccination is an essential part of disease prevention, but it should be complemented by other biosecurity and health management practices for maximum protection. Parasitic control. Managing internal and external parasites. Parasites, both internal and external, can cause serious health issues for livestock. Internal parasites, such as worms, and external parasites like ticks and lice, can compromise the animal's health, growth, and overall productivity. Here's how to manage parasites effectively. Deworming programs. Internal parasites, such as roundworms and tapeworms, can severely affect livestock health. Develop a deworming schedule based on the type of livestock you raise. A veterinarian can help you determine the best time to deworm your animals and which products are most effective. Fecal testing. Before administering dewormers, consider conducting fecal tests to identify the specific type of parasite affecting your livestock. This can help tailor your parasite control plan and prevent the overuse of deworming medications, which can contribute to parasite resistance. External parasite control. External parasites, such as ticks, lice, and mites, can cause infections, skin conditions, and general discomfort in animals. Use insecticides or natural remedies, such as diatomaceous earth, to control external parasites. Regularly inspect your animals for signs of external parasites, such as hair loss, scabs, or itching. Pasture management. Parasites thrive in overgrazed pastures and areas with high manure concentrations. Practice rotational grazing to give pastures time to recover and reduce parasite loads. Keeping the pasture clean and free from manure will also help minimize parasite risks. By implementing an integrated parasitic control plan, you can reduce the impact of internal and external parasites on your livestock and prevent diseases associated with parasitic infestations. Early detection and monitoring, catching diseases before they spread. Early detection is one of the most critical aspects of disease management. The sooner a disease is identified, the quicker you can take action to prevent it from spreading and causing widespread damage. Regular health checks, monitoring for symptoms, and maintaining a disease surveillance system are all essential components of early detection. Here's how to monitor your livestock effectively. Daily inspections. Inspect your animals daily for signs of illness, including changes in behavior, appetite, or physical condition. Early signs of disease may include coughing, lameness, diarrhea, abnormal discharges, or changes in coat condition. Temperature monitoring. Use a thermometer to monitor the body temperature of your animals. An elevated temperature often indicates the presence of an infection. For example, the normal temperature for cattle is between 100 Mabriquini and 100 Tutti, and for pigs, it's around 101 to 120. Fecal and blood testing. Regular fecal tests help detect internal parasite infestations, while blood tests can identify viral or bacterial infections. These tests can be especially important when dealing with diseases like brucellosis or bovine tuberculosis. Veterinary support. Establish a strong relationship with a trusted veterinarian who can help with regular health checkups, diagnostics, and disease surveillance. Veterinary expertise is invaluable when it comes to early disease detection and management. Disease reporting systems. Implement a disease reporting system on your farm. Track any signs of illness, treatments used, and the effectiveness of those treatments. Having accurate records helps identify trends and potential risks over time. Early detection is key to preventing the spread of disease within your herd or flock and can help you manage outbreaks effectively. Isolation and quarantine, containing the spread of disease. When a disease is suspected or diagnosed on your farm, it's crucial to act quickly to isolate and quarantine affected animals. Isolating sick animals can help prevent the spread of infectious diseases to healthy livestock. Here's how to implement quarantine effectively. Designate isolation areas. Set up specific areas for isolating sick animals. These areas should be separate from the main herd or flock to prevent cross-contamination. Ensure that isolation areas are equipped with their own food, water, and medical supplies. Quarantine new arrivals. New animals brought onto the farm should undergo a quarantine period of at least 14 to 30 days. This gives you time to observe for any signs of illness and perform diagnostic tests before they interact with the rest of the herd. Monitor quarantined animals. During the quarantine period, regularly monitor the health of isolated animals. Check for any signs of disease and consult a veterinarian if necessary. By having a well-established quarantine protocol in place, you can minimize the risk of an outbreak and contain diseases before they spread throughout your farm. A holistic approach to livestock disease management. Effective livestock disease management requires a combination of biosecurity, vaccination, parasite control, early detection, and isolation measures. By implementing these strategies, you can protect your animals from diseases and ensure the long-term health and productivity of your farm. Remember, no single strategy will completely eliminate the risk of disease, but by combining several approaches, you can significantly reduce the likelihood of outbreaks and manage diseases more effectively when they occur. Thank you for watching. Don't forget to like, comment, and subscribe for more expert tips on livestock health and management. Stay tuned for more in-depth discussions on specific diseases and advanced disease management techniques for different types of livestock.